So if you check the current standards or guidelines, which would be the American Diabetes Association and the American Association of Clinical Endocrinologists, both advocate initially for starting with a single agent, whether it's metformin, which is a biguanide, and then subsequently adding on other agents. What we know in the United States is that diabetes is a progressive disease. So the longer you live with the condition, the more likely you will require more than one medication unless you significantly change your diet and activity level. Patients or the public tend to associate the number of medications, particularly the number of pills, with worsening of their disease or condition. And so what a lot of pharmaceutical companies have done, and WellCare supports, is the combination of medications such that it's 2 medications in 1 pill. And so with combination therapy, to the patient, it's 1 pill, but it's actually 2 medications. And in the last 25 years, we've seen an expansion in the number of oral anti-diabetic agents. Insulin, as you know, was developed in 1921, and about 35 years later, sulfonylureas came on the market. But then if you fast forward to 1994-95, the biguanides or metformin, which I reference, is what became available. And then within the last 25 years, you see this expansion of another 10 agents in the class. So as our knowledge about diabetes and how to treat and manage diabetes becomes more refined, more agents have become available. And so these are basically tools in the provider's belt that help him manage a diabetic. At WellCare, we try to ensure that all of these tools, these medications, the low cost affordable options are available on our preferred drug list. So we work with the provider community to make the oral anti-diabetic medications and insulin available on our preferred drug list so that providers have access and our members have access to those medications. But again, there is a myth that the number of medications you have or that you're on portends worsening of your disease. And so it's about education and awareness and to ensure our members and patients that the number of medications is not meant to be punitive, but rather supportive to help. And again, not all medications work for every patient. The drug cocktail is very patient-centered, very individualized, such that it has to take into account other comorbidities and conditions you may have that may not allow you to take one agent over another.